We teach, coach, inspire nurses and nurse practitioners, medical health professionals to start IV hydration businesses on the side. Why I love IV hydration and think it's such an easy business for nurses to transition to. But it's more so about things that Dr. Lendra has been talking about, which is just the freedom that you have, doing something for yourself, that generational wealth.
Welcome to Nurses with Voices. I'm Dr. Lendra, your host and fellow nurse who's traded in burnout for breakthroughs. I'm here to show you how to transform your nursing career into one filled with purpose, reduced stress, and incredible opportunities. Whether you're looking to start your own business, build generational wealth, or simply find a healthier role in nursing, this podcast is for you. Join me to explore practical strategies to overcome burnout, combat bias, and chart new paths in nursing. It's time to reclaim your voice and reimagine your future in healthcare. Let's get started. Welcome back to another episode of Nurses with Voices. I'm Dr. Lendra. I am so excited to share with you what took place at the Health and Wealth Expo, a virtual summit this past weekend. It was just absolutely amazing. But before I get into that, I have to talk about and give you guys some hot topics of what's trending right now. And one of the things that I wanted to really highlight is this attack on healthcare right now. What is going on with the violence against healthcare workers? I'm just blown away. Like what is happening and why? I mean, okay, workplace violence against healthcare workers unfortunately, it's actually not a new topic because it has happened. I mean, there is a nurse on LinkedIn who she shares her story how a workplace attack ended her career. I feel like it's happening just more and more, and so think about the United Healthcare CEO who was murdered. And then now we have our healthcare workers who are now under attack. And I'm talking like two incidences in, I want to say they're in a matter of days, if not at least 2 days. Maybe I heard about them 2 days in a row, but this is how consistently it's starting to happen. So I'm just wondering what is going on that this violence is just escalating. And if you guys know, please leave it in the comments. Tell me, I want to know what your thoughts are, why this is escalating. But I will share this, and I'm going to read this right from the article that it came from. And this is from a political report for U.S. News on Pennsylvania hostage taking and shootout highlighting rising violence against U.S. hospital workers. A man who took hostages in a Pennsylvania hospital. Now, this man came in zip-tied ICU healthcare workers, nurses, and doctors. So and someone was actually shot. But let me just read it before I get ahead of myself. But I'm just reading this and I'm just keep asking myself, what's going on? Now, a man who took hostages in a Pennsylvania hospital during a shooting that killed a police officer and wounded 5 other people highlights the rising violence against U.S. healthcare workers and the challenge of protecting them. We're not even safe at work anymore. What really, really pulls at my heart is the fact that as a healthcare worker, a lot of times, especially working 12-hour shifts, and a lot of nurses work anywhere between 36 to 60 hours a week, meaning they're spending more waking hours with you and your loved ones as opposed to their own families. And what happens is your environment becomes like your family. You get attached to patients, especially when they're there 2-3 weeks at a time. You get to know them. You build personal connections with them. So this is hurtful, and it's heartfelt, I should say, that people are now turning on healthcare workers when the conditions that some healthcare workers are working under. And let me preface this by saying this may not be every condition, but there is a lot of trauma. There is a lot of burnout. During COVID, nurses dealt with traumatic experiences. Healthcare workers dealt with traumatic experiences. We were heroes and then we weren't, right? And then the violence came back. And now this is just escalating And it's like you don't even feel safe at work. And these are the people who are helping you and your loved ones. I guess I say all of this to say I'm just really, really concerned about the state of healthcare. I'm really, really concerned about why this is escalating the way it is. And there's a concern for safety, and it's legit. This is a legit concern. Just going on and reading more about this particular incident, and I can't pronounce the name. Diogenes Ortiz, 49, carried a pistol and zip ties into the intensive care unit at UPMC Memorial Hospital in southern Pennsylvania, York County, and took staff members hostage Saturday before he was killed in a shootout with police, officials said. The attack also left a doctor, nurse, custodian, and two others officers wounded. What is going on? I mean, I'm so taken back. I'm at a loss for words, and that doesn't really that doesn't really happen with me. This is so concerning that this is happening. It really, really, truly is. Then there was another incident. Now, this particular incident was in Chicago, and the ERMD, an emergency room physician, was stabbed at Providence Hospital in Chicago. Violence against healthcare workers is out of control. Yeah, like an emergency room physician was stabbed. So we have the United Healthcare Workers CEO, and a lot of people didn't really give a lot of empathy towards that situation. And now we have this trickling into healthcare workers. And might I add, and I'll say this again, healthcare workers, this is not violence in healthcare is not necessarily new, but it's escalating. So there's a problem, and there's a concern here, and we really need to take it serious. And when we look at the political aspect of what's happening in healthcare right now, you have federal healthcare workers losing their jobs. The NIH, there were tons of physicians and healthcare workers who actually lost their job. Nurse.org actually reported that 5,200 health agency jobs at risk. FDA, CDC, and NIH face major staff reductions. Thousands of employees across federal health agencies received unexpected termination notices over the weekend, with the Trump administration citing poor performance and changing agency needs. The move, which affects workers in drug inspection, AI development, maternal health, and disease response, has sparked concern over its potential impact on public health services. So I actually saw something on social media where there was a young lady who was actually in the hospital receiving what appeared to be cancer treatment. And she had a portacap in her chest, and she herself was actually nervous and speaking to what's happening. She was able to sense the tension in the air. And I can imagine, I'm sure the tension in the air in those hospitals are thick. You can probably cut them with a knife. And she can overhear nurses and doctors not really knowing if they were going to have a job. She can overhear conversations outside of her room. So you got the attacks on healthcare workers. You have the termination of healthcare workers. But guess what? You still have sick patients. You still have patients who need medical care. You still have patients who, the nurses, I mean, we talk about staffing all the time and wanting to be short staffed, and we're wondering why people are leaving the bedside or leaving the inpatient setting. It's almost like no place is safe. Now, from a political stance, the American Nursing Association participated in creating the Nurse Faculty Shortage Reduction Act. And this was introduced in the Senate in July of 2024. So this bipartisan bill would create a 5-year pilot project for schools of nursing to apply for grants from the Health Resources and Service Administration to supplement the difference between what faculty nurses are paid versus what equally trained critical care nurses earn. I share this with you. This is actually from 2024. With what's happening now, we need to take a stance. We need more right now. We need to take a stance that is political, but also stands firm in Congress. And there's an understanding of where healthcare workers need to be. And you know what? This is why I put on events like the Health and Wealth Expo. because more people need to be in the rooms. People need to be in the rooms to position themselves so that they understand and not have to feel fear, right? Not have to feel fear of losing their jobs or having to worry about short staffing, working understaffed, working and feeling unprotected or feeling unsafe. Guess what? You can work from home, start your own business, make your own rules, go on vacation with your family when you want to, and not have anyone tell you when you can go on vacation, when you can spend a holiday with your family. Enough is enough. So with the new administration, we know that there are a lot of executive orders being put into place. Keep in mind, they're just executive orders. Executive orders do not mean that it's law. They're executive orders. So keep that in mind. So there's a lot of politics happening. And I wonder what RFK Jr. is going to do. You know, he's over Health and Human Services. And what is he going to do about the attacks on healthcare workers? What is his stance on that? I'm curious to know what is his stance on the attack on healthcare workers. We're Health and Human Services, right? So it's not just the diseases; those are important too, absolutely. But what are you going to do about your healthcare worker crisis? What are you going to do about the healthcare workers who are under attack right now? So I would be curious to know. One thing I will say, and I will say this again, and I know I just said it, we need to position ourselves as healthcare workers. And a great way that a lot of what nurses are doing now and taking their power back, and I am so proud of them, is attending events like the Health and Wealth Expo. We had our Health and Wealth Expo, a virtual summit, and I know I'm just like turning. You probably feel the energy, and I'm lighting up now because it was such a spectacular event. And these are the type of things, and these are the rooms, and these are the type of things that we need to be doing. We need to be in the rooms with these type of topics taking place, with this type of inspiration, empowerment, education. This is where we need to be. This is where we need to be. We need to be making sure that we're positioning ourselves. Do not stay in an environment where you're under attack. Now, and let me share with you some of the things that we talked about over this past weekend. We had, and I'll just start, and I'll just run it down for you. Let me just start from Maggie. So we had Maggie Ortiz. She's a master's degree prepared nurse, expert in legal nursing. She gave so much information on legal nursing, how you can use your expertise. People don't think about that. Legal nurses are actually the ones who support attorneys. Think about it, especially in malpractice cases. Attorneys, they don't know that the jargon, they don't know the information. They have to consult with a lot of times physicians. And guess what? We actually cost less than physicians. And I think it's just like that age-old thing. A lot of people, they say, oh, well, they need a medical professional. Well, we're medical professionals and we actually write the chart and we cost less, right? To be able to provide you with the information. And nurses can actually make a career out of legal nurse consulting, and it can actually be a profitable career. Let me just add that, because you're doing things that you already know. You've been trained already. You're taking your expertise. You could be an expert witness. You could be an expert for forensics. You could be an expert for medical malpractice, for critical care. There's a lot of opportunity in legal nurse consulting, and Maggie did a great job at breaking that down. Then you have Crystal Parker, the MP. Crystal did a great job of breaking down how to start your own IV hydration business. She gave a huge highlight on just that. Just really, they were really sharing their knowledge. And the people who showed up, I thought, yes, you had some people who came in and, they heard the topic they wanted to hear and they left because it wasn't all day event. I was surprised at the number of people who stayed from the time we started at 11 a.m. until 4 p.m. People were glued to their seat. I'm still getting messages on how well this was put together, on how they just couldn't leave their seat. Like I even had to give like breaks so people can take a break and come back. It was so well put together, and I'm just so excited at turnout. And let me take my glasses off. You guys know I always get the glare, and I got to take my glasses off for a second. Then we had Dr. Linda Logan. Dr. Linda Logan, she comes from such a place of nurturing and just empowerment. She blends it. So she blends inspiration, nurturing, and empowerment. all in one. And it's just absolutely amazing.
So I want to express my deepest gratitude to our host, Dr. Lendra James, for hosting such a powerful and impactful Health and Wealth Expo event. It's virtual, but it's powerful. And then the in-person is coming. It's going to be on fire.
So, and she blends this, and I love it. She just really broke it down on, being able to start your own mental health practice and how she did it and what she did. And she provides guidance. She does have a program for nurse practitioners who are interested in starting their own mental health practice. She has a wait list, and I'll make sure it's in the show notes. There's a wait list that you can join her program. And I believe she said it's March that she's going to be starting her new cohort on how to start your own mental health practice. And then we had Dr. Ebony Gray. Dr. Ebony Gray, all of the ladies I'm still getting, calls for, we actually did a giveaway on the most engaged. And it was so hard to choose the person who was most engaged in the chat because everyone was so engaged. And, we had to just really just put names in a hat at a certain point because everyone was so engaged. And the young lady, so one of the giveaways where you got to have a free consultation with the expert of your choice. And she chose Dr. Gray. Dr. Gray really broke it down on how the experts have people. Like I said, people are still contacting me for all of the experts, but the one who won the giveaway, she wants to speak to Dr. Gray because she really broke it down on how you can work with the government and how you can get these contracts as a healthcare worker. There are so many contracts. And I think, again, this isn't something that's introduced to us. This isn't something that we know of how to do, what to do. And the fact that she's giving us these gems and she's breaking it down step by step, and she knows her stuff. Like, she's very, very in tune with government contracting. And listen, Dr. Gray is an expert in what she does. And the attendees, they felt that. They know that. And it was obvious that all of the experts were expert in what they did. If you did not make it to the Health and Wealth Expo, you have to join us at the Health and Wealth Expo live in-person summit, May 15th and 16th, taking place in New Jersey. In New Jersey. So you guys may or may not be aware, I am a native of New Jersey, making this a complete passion project for me. And well, the Health and Wealth Expo is a passion project for me, just all around. The event that's going to take place in New Jersey, I'm looking forward to it, to really bring something to New Jersey that is for nurses, that is for healthcare professionals, and that's bringing you your empowerment, your education that you need. We're going to have roundtable discussions. We're going to have everything that went on at the expo virtually. And like I said, during the expo, think about it on steroids. The 2-day event is going to be that on steroids. And that's how I'm explaining it right now, because it's just going to be phenomenal. We have keynote speakers, we have roundtable discussions. We're going to continue with our educational workshops. We had, and I can't forget this one. It's a Health and Wealth Expo, right? That said, we have financial education. Teresa Barrow did a great job at really helping us to see what we're not always taught. A lot of times when we get our jobs upon hire, we know that we have life insurance benefits and we sign up for life insurance and we sign up for our 403Bs or 401Ks, but we don't necessarily know what that means. And Teresa did a really good job talking about the secrets of money and how we can build wealth. She talked about IULs a little bit, and all of this information is available with the replays. So I'll make sure that the replay link is in the show notes as well. If you missed Anita's session on funding, once again, so engaged. Anita gave a really good breakdown on funding and how you can contact her. So again, all of this information is going to be in the show notes. I'll put in the show notes how you can access Crystal's information, Maggie's information, Dr. Logan's information, Ebony, Anita, Teresa. So I'll put all of this information in the show notes so that you guys can really be able to, and I'll put the information in the show notes for the replays, because I want you guys to be able to not only contact these experts, individually, but also get access to the replays. It was just so much energy in the room. And this is where we need to be putting our energy. We need to be putting our energy into investing in ourselves. We need to be investing in ourselves. We need to be positioning ourselves. And that way we can be a part of the solution, right? We see all of the problems taking place in healthcare right now, but you have to ask yourself, how are you a part of the solution? What are you doing? How are you positioning yourself to be a part of the solution? Are you investing in yourself? Are you taking and investing in yourself is not just money. It's the time that it takes so that you can escape unsafe work environments, so that you can escape toxic work environments. Or when you just know that it's time for a change, what are you doing to position yourself for that change? You really have to start asking yourself that. Something that I put in my LinkedIn newsletter today, I put 3 things that you need to know and 3 things that you need to do. One, you need to know your power. You do not have to stay in an environment where you are not valued or your worth is not recognized. Second thing is walk without fear. Do not allow intimidation to dictate your career or your life. And the third thing is find your people. Partnerships truly, truly, truly matter. You'll be surprised at when you partner with the right people, when you surround yourself with the right people, your mindset starts to shift. And a lot of times we need that, especially after going through burnout or going through traumatic experiences. We need to be surround ourselves with the right people so that we can start to develop a growth mindset, something that we may not have been exposed to throughout our careers. So it's important to have a growth mindset, and it's important to be around people who, you trust, and something that we say in business is know, like, and trust. People do business with who they know, like, and trust. Well, it's important that you surround yourself with people who you know, like, maybe even love and trust. So that's what I want you guys to take away from today. Thank you so much for joining. Thank you for allowing me to recap the Health and Wealth Expo virtual summit. Thank you to our sponsors, NOLA with Nursepreneurs. Thank you to our sponsors, Quantify Media. Thank you to everyone who's attended. I will definitely put all of the information in the show notes. I want to see you. You guys will be hearing more about the Health and Wealth Expo live summit that's taking place in May in New Jersey. You'll be hearing more. And the new website is healthandwealthexpolive.com. You'll see the new speakers. You'll start to see them, who's going to be at the summit, at the event. And I can't wait to see you guys there. So until next time, make sure that you guys stay inspired, stay educated, and stay empowered.